Dr. Richard Buckley, Milford MD. Today's project was liposuction, lipo-sculpting of the upper arms, the axillary bra folds, the upper back, the middle back, the lower bra folds. And we're now going to do revision on some scars our patient has from some procedures elsewhere. And I'm going to do M-plasty, also known as W-plasty. Turn the M upside down, you have a W. But in any case, instead of making a straight line or a curvilinear line, one can make a zigzag line. It's more work, of course. But a zigzag line is much harder for the eyes to figure out, and so it disappears better. And that's what we're going to do. We're going to do some W-plasty. Technically, it's under what's called tissue rearrangement. So in the center of the zigzags, you can kind of make out, I think, that it looks like the skin's up and down, and there's some different color here. It's a little gnarly looking. And indeed, that's all some very obvious scar tissue. And if I close my eyes, I can feel it all sticking out here. The patient doesn't like that. And in just a minute, it's going to be gone, right? So that is a kind of tissue rearrangement plasty, little skin plasty. So it's scar revision surgery. Also, we've been harvesting fat. So I have lots and lots of these. A lot of fat in a bucket, and then I put them in these, and then I put a tiny little cannula on the end, such as that, for example. And then out of that, I can squirt a little bit of fat. We're doing natural breast augmentation with our patient's own fat cells, taken from areas where she no longer wanted the fat cells, maybe didn't even ever want them, and putting them in an area where she would like to have some augmentation and some smoothing. You know, with time, the upper parts of the breast, the so-called upper poles, can kind of lose apparently more volume than other areas, get a little dished out. It's nice to have them, you know, full. So we put 400 cc's of fat in the right breast, and we're going to do the same to the left in a few minutes. In the meantime, I'm going to fix this scar. She has another one on the other side. We're going to get rid of that one as well. Are we doing anything else? That's pretty much it, right? Arm liposculpting, side liposculpting, back liposculpting, transferring the liposculpted living cells to the breast, so natural breast augmentation with their own autologous fat. And by the way, fat's the richest source of stem cells in the body as well. So it's really sort of a fat, not only fat graft, autologous fat transfer, but it's a stem cell transplant. It's pretty cool. And then we're going to fix these scars. Thank you for watching Milford MD Live.
All right.